UT Health Audiology Department, is that right? Or session 4. Okay.
All right. Okay, so tell me, what have you been able to practice over the week?
Been able to practice the
flow.
The flow.
Okay.
And that's pretty much all I did practice. I did a couple of the I call them siren exercises, but the where you make the sound and go up and hold it and down.
Now, was that with a straw or was that
yes,
without?
One was with straw. Yeah.
Okay.
The bigger straw.
Okay.
And been pinched at the end a little bit, but not too much.
Okay. So I know when you left me the last time we were trying to figure out how to work through skill 2 of flow phonation. I think you were having a little bit of trouble figuring out how much of your voice to add and how much air to keep going. Were you able to sort of figure that out, or did you have some trouble with that?
I didn't really address it this week.
Okay. Well, tell you what, I have a new exercise that I want to introduce to you today, okay? But it sort of extends from the flow phonation. Okay. So I want to make sure, I want to sort of revisit skill 2 and make sure that that one is clear and that you're able to do that before we move on to something different. Okay. Would that be okay?
That would be perfect.
Okay. So remember that with skill 2 of flow phonation, that's going to be this sheet right here. And if you don't have it, I have an extra copy for you.
I see that right here, but I'm not organized.
So it's essentially the same targets that you would have for skill 1, only that for skill 2, you are adding a little bit of voice. Just a little bit.
Okay.
Okay. And then remember we talked about not getting into a whisper, but maybe staying somewhere in the middle of a normal voice and something more breathy. So what I did is I said, when you're thinking about the air and the voice, you just want the air to sort of dominate, right? Okay. And that's what we're going to use as a visual key to remind ourselves what we're supposed to be doing throughout these different exercises.
More air than voice.
More air than voice. Yep. So we practice with something as simple as a sustained ooh sound, right? And that would sound more like a who, because we're using a gentle onset to get our voice going. Ooh, a little bit of air first to start with, and then we turn our voice on. And we use the tissue to help us visualize the airflow so that we know we're not cutting back on that. Right? Do you perceive a difference between these two? And
the first one was a little more poppy, or what was the difference?
What about what you're hearing? Do you hear the voice with the first one?
No.
But do you see the tissue move?
Yeah.
So you know there's airflow. Now I'm going to add a little bit of voice, so you should see the airflow and hear something.
I honestly didn't hear that.
Now it's not going to be loud, but you should be able to hear something.
Yeah, I did.
Right? And that's the same thing for skill 2 with any other target that we work through.
Okay.
It's going to be just a little bit of voice, but mostly air coming through.
Okay, you want me to do that?
Yeah, we can do who. Can you make it more breathy than that? Good. Good. Okay, what if we did something different, like ooh, ee, ooh?
Almost like a whimper.
Yeah, a little bit.
Yeah.
But we're going to let that air sort of carry our voice out. Ooh, you. Now I use more voice there just so that you can hear what I was wanting you to say.
I didn't see much there, did I?
But it's going to be just like that. See if you could do it on one breath instead of...
Okay.
pulling it apart. Okay, good.
Yeah.
Ooh, ooh would work perfectly too. That's the second target.
That's like a whisper.
Did it feel like a whisper?
That feels like a whisper. Is that a whisper?
How does it feel in your throat? Does it feel like you're straining to get that out?
No.
So it sounds a little like a whisper, but it sounds more like what I'm trying to get you to do. The way that you distinguish that from a whisper is that with a whisper, we tend to push down a little bit more. Hey, come here. I can feel the difference, as opposed to with flow phonation, everything remains relaxed. Okay. Good. Does your throat still feel relaxed?
Yeah, totally.
Okay,
I
good.
didn't do that all day long, but didn't feel like my vocal cords were vibrating.
Not so much, no. What's happening is that they're barely coming together.
Okay.
Okay?
But they are forming those sounds, though.
They are. And for us to hear the sound means that they are coming together. They're making contact, but it's just a lot more subtle than if I were to say wah.
Wow, yeah.
Mm-hmm. Okay, what about poo-loo-poo? Good. What about that one? Do you feel like you're straining with that one? No. Okay, so no
I don't
pushing.
think I'm straining on any of them.
Okay, good, good. How about something longer like who sees through? Who sees through? Oh, and we don't want to compromise the air, so we want to see it continuing to move. There you go. A lot better. You're basically relying on the air to get your voice to come out.
Okay. Just want to stay straight with it.
You should be able to see that string moving. Yep.
Caesar, what should we do? 1, 2, 3. Waiting for you.
Waiting for you.
Reading soon.
Okay, how are you feeling now? You've gone through a number of phrases. Do you feel like anything's sort of pressing down on your throat, or do you still feel relaxed?
Relaxed.
Okay.
I could probably talk with that all day.
Good, good. No, I like that you did that because, you know, we don't really ever get a chance to look at conversational speech too much. That's kind of what I hope you carry over at home, is that you find a moment to have a conversation with someone where you're practicing the skill.
You don't need to talk to somebody like that. You leave there.
I'd like for you to do that, yeah. I don't know if I wrote that down on your last homework card, but usually by this point I will have you begin finding a moment or a partner to sort of practice the skill with, so that just like you did right now where you talk to me with the paper. So in essence, the person speaking with you wouldn't have to practice the same skill, but they could ask you some open-ended questions and have you respond using flow.
Okay, this is not a whisper.
Sort of like a whisper, but we want to refrain from pushing down like the way we would if we were whispering.
If this would be a whisper. No, this would be a whisper. Not this one.
So with flow, you see a lot more air come through. With a whisper, we tend to sort of hold our breath a little bit.
Okay.
Yeah, with flow, we're really wanting the air to pass through our mouth. Okay, now as we go up in skill, which we'll only spend a little bit of time today on skill 3 because I really want to get you into this new exercise. Okay. This is where you begin to fade the tissue and just focus on the airflow, adding more volume to your voice. So it's going to sound closer to normal voice. Okay, so what I would do is I would start with skill 2. I might say, and then I would fade the tissue, ooh. Okay, but letting air come through first. Ooh. Good, good.
Okay.
We call that a gentle onset, where air comes through first before you initiate your voice, that means your vocal cords come together like this and they stay slightly open. Okay? And that's really to get your body to recognize that it's okay to keep your throat muscles relaxed. You don't have to use them to get your voice to project. You can actually use the air to help move that voice forward. Okay? All right, how about wah, wah, wah? So I'm going to say wah, wah, wah. Yeah, we got more voice coming through, but we still have the air moving.
Right.
How about pulu, pulu? Pulu, pulu. How did that one feel? So we know that with those sounds in particular, we've got the air passing through the center of our tongue. It's coming down the center of our tongue, and it's
down the top of my mouth.
and it's coming through your teeth. So you'll see a little bit of movement, and then
So the vocal cords fire off at the Z sound.
yeah, that's more of a voiced consonant sound.
Yeah.
So there's a difference between those two sounds also. They're both made in the same place, but one is more voiced than the other. Right? But we don't want to compromise the air just because we're turning our voice on. We want to still be able to see the same movement. You see that? There you go. Nice. You may not see as much with certain sounds, right? But another thing you can do instead of watching for the movement is hold your hand in front of your mouth and feel for the air coming through. You feel that air?
That's what it's Z.
Yeah, some are more obvious than others. And then you can do the same thing for the phrases. So, who is Lou?
Who is Lou?
Good.
What are you going to do? Trying to establish flow before you energize your...
You do. You want to establish the airflow first, just the way that we do with the straw warm-up.
Okay, right.
Where I have you let a little bit of air out before you turn your voice on.
Right.
It's the same concept.
Who is Lou? Who is Sue?
Who is Sue?
Who is Lou? Who are you? You need to be louder. Who is Pooh?
Are you trying to speak softly? Or are you using your normal voice? I want you to use normal. So not trying to project, but also not trying to be quiet.
Okay.
So closer to normal. Who is Pooh?
Who is Lou? Who are you? Who is Sue? Who is Pooh?
There you go.
Who is Clue? Fast Freddy sells French fries.
So essentially what you do by that point is you're not going to see as much airflow come through as you would with the who's, right? But you can overemphasize the sounds of those consonants like fussy, wally. I don't ordinarily put so much emphasis on that F sound, but for the sake of this, I will.
Wally.
There you go.
Wag the fingers.
There you go. There you go.
See Sally. See Sally sleep. See Sally sleep soundly. See Sally sleep soundly by the seashore.
Yep. So you see that by these longer utterances, you're going to really have to practice good breath support, right? So we want to make sure we're taking that full breath before. See Sally sleep soundly. See Sally sleep soundly. See Sally sleep soundly by the sea. Good, good. And I continue to see that tissue move, so I know you're still practicing good airflow.
Zebra zigzagging. Zebra zigzagging at the zoo. Vince vowed to vote.
Good. How are you feeling in your throat?
Fine.
Okay. You don't feel like you tensed anything down in your throat to get the sound to come out, or do you feel that it was just as easy as it had been before?
It's just not, it's easy, but I have to think about it.
Okay.
You sit there and think about it.
Yeah. It, it does require thinking, especially when you're moving from one skill to another. It's going to require you to sort of process things a little differently. But that's why we practice together, so that hopefully over the week when you're on your own, with enough times you should be getting a little bit better and it should be coming a little bit easier for you.
I still find myself talking too soft.
Okay.
That voice trailing off, it was like this. I have to be consciously aware of it.
Yeah. And it's going to start like that for a while where you're going to have to put a lot of effort. And it may be that in order to maintain your new voice, once we get to that point, that you're comfortable with the voice that you have, then, it may require maintenance here and there where you're having to kind of monitor yourself and make sure that you're practicing the skills that you're learning.
Yes.
Okay. Now, we did all of this to set the foundation for what we call, we'll put that off to that side, what we call resonant voice, okay? In other words, a forward-focused voice, right? That's why I say overemphasize those consonant sounds so that you can feel it forward, okay? You can feel it somewhere up in the front, somewhere in the mouth, okay? We use the airflow to carry our voice out, right? We practice good open mouth posture so that nothing is sort of constricting the space that the air and the voice have to travel out of, right? That's why we have to be conscious about, our posture as well.
Right.
We feel like we're not getting the air out. Are we relaxing our jaw or are we tightening? What about our tongue? Is the tongue relaxed or is it retracted and pulled back? We have to ask ourselves these questions if we're having trouble getting the air to come out. Okay, now once we have established those two things, then we can begin to project our voice somewhere in the mouth. Okay?
What did you say, third voice?
No, our voice comes forward, right? So we use the megaphone to sort of drive the point that you're going to use this area, either your nasal cavity or your oral cavity, to help the voice resonate.
Right.
Okay? So that's what we mean by forward. It means not down here in the throat, but rather somewhere more forward.
Okay.
Okay? And again, we're going to use that airflow to facilitate that transfer of the voice from here, because it's always going to originate down here, but we don't want it to stay down here. We want it to come out of the mouth. Okay?
Okay.
Any question about this and the direction that we're going?
No, not yet.
Okay. So how do we achieve forward focused voice? Well, we're going to go off of our perception and what we're feeling in our mouth or not feeling. Okay? So the same way that you've been able to visualize the airflow and you see the movement of the tissue, that's one way that we sort of monitor airflow. But now we're going to monitor our voice quality.
Okay.
And we're going to do so by asking ourselves some questions. Where do I feel the vibrations primarily? I know that they originate here, but where do I really feel most of the energy sort of focusing? It should be somewhere here.
Okay.
So how do I feel for that? I go off of the vibrations produced somewhere in the oral cavity or the nasal cavity, right? It should feel easy. The throat should remain relaxed. That's why I kept asking you throughout flow phonation, does your throat feel relaxed? That's not where we're deriving the power from. It's not from the muscles in our throat. Okay? If it's not relaxed, we have to think about what can we do to get it to relax so that it's not interfering with the voice coming out. Okay, let's see. Am I using the air to release the sounds? That's why we look at flow phonation first before we get into resonant voice. Okay, and can I create more space to help that voice come through a little bit better?
Right.
which is what I talked about before with relaxing your jaw and your tongue. If you find that those two things are really inhibiting, then we can go over some stretches for that so that you can feel like you're exercising a little bit more of an open, relaxed mouth posture. Okay? And then is the voice that's coming through smooth or is it choppy? Does it sound like there's some voice breaks where, my voice is there and then it's not there? That's what we would consider choppy.
Okay.
As opposed to a smooth voice that comes through all the way.
Right.
Okay. So begin to think about these questions as you're working through these exercises so that you can sort of figure out, what the best way is to fix anything that may happen. Okay? If it's not coming through, if it's choppy, if it sounds pressed, absolutely. Yeah. So I'm going to ask you frequently throughout these exercises what you're feeling, because I can go off of what I'm hearing, but sometimes what I'm hearing doesn't match with what you're feeling.
Okay, so you said I'm going to my vocal cords to vibrate, but I'm not going to feel the vibration because we're going to move.
You should be able to feel it somewhere in your mouth.
Okay.
And that's why.
That's where you come up with the resonance. Right?
Yes. So if you've ever played an instrument, you want the same way that the sound resonates in the bell of the instrument.
Right.
It's the same way that you want to sort of view your own mouth and nose as the bell of your voice instrument. Okay? So it helps sometimes for patients to begin visualizing their own voice as something tangible, something that they're aiming toward the front of their mouth.
Yes.
Sometimes the conscious effort can help you find the correct placement. Okay? All right, so we start out with some isolated sounds that will help you begin to detect the vibrations in your mouth. Okay, remember that I said some sounds are easier to perceive than others?
Yes.
These are those sounds. Okay, we start with a simple hum in isolation.
Keep my mouth closed here, don't I?
We're going to keep it closed, but tell you what, I'm going to ask you to change your mouth posture just a little bit. Okay, what you're going to do is relax the jaw, so keep it from clenching. You're going to relax it like you're holding something in your mouth. I'm going to go ahead and demonstrate for you. This is what I want it to look like. See, I'm pretending like I have something on my tongue.
Mouthwash or something.
Sure, like you're trying to prevent it from falling down, right? You're holding it in your mouth. And now you're going to think about getting your voice to come and project right here in your lips. Okay, what are you feeling?
I kind of feel like it.
You feel any vibration going on somewhere in the oral cavity, somewhere in the mouth?
Yeah, the specific tone I get feel on my lips.
Now sometimes if we can't feel it, we can do some other things aside from relaxing our jaw to see if we can get the voice to come forward. Something as simple as adjusting your pitch. So maybe if you were trying at a higher pitch, you could drop it down. Is that better or worse?
All right.
Is that better for you? Okay. Good. I like that you're breathing in between, because it's also going to require that you get enough respiratory drive to get that voice to come forward.
Right.
So you see how you hired your pitch? Was that better or worse?
I'm on the N.
Oh, are you on N now?
Should have said it's on N.
Well, if you feel good about the M, then we can move forward. I just want to make sure that we've established what you're supposed to be feeling.
I'm going to do the M.
Okay. Now, do you hear the difference in quality? Because I'm picking up the difference. It starts out forward and then it kind of drops back into your throat. See what you can do to get it to stay forward. If you feel like it's beginning to drop down because maybe you're running out of air, then I want you to stop before then, because we want to prevent you from going down into your throat. That sounds a lot better. Okay, and at that point I would stop, because now it's beginning to drop down.
Yeah.
Try relaxing your jaw just a little bit more. How about dropping your pitch? Better? Worse? It sounds to me like it's not dropping back.
That's the easiest one right there.
Okay, take note of that. So lower pitch, but also something else to consider is your intensity level. So how loud you're getting.
Right.
Maybe sometimes you might find that making a softer volume helps, and you can stay there for as long as you need to before you regain the confidence to start increasing your volume.
Yeah.
But it's more so about the quality than anything else. So don't focus on how loud you are, just focus on what it sounds like. And that's why I gave you that sheet to sort of think about it. Does it sound choppy or does it sound smooth?
Right.
Okay. So let's go on to a different sound. How about N?
That was like a double vibration there. That was a choppiness, right?
It sounded choppy to me. It did. And do you hear how at some point it kind of goes back down? Okay, let's do this. Every time we practice this sound, I want us to really think about our posture.
Okay.
Take in that full breath. Make sure it's coming from your abdomen.
Right.
Okay. When it is forward, where are you feeling it?
Where it's what?
When the voice is forward, where are you feeling it?
Let me try again.
Yep. You feel it there because the tip of your tongue is behind your top teeth as you're making that sound, so you should be able to feel more sensation down in that area.
Nasal cavity. Yeah.
Yeah, because the M and the N are both nasal sounds. So if you put your finger against your nose, you should be able to feel some vibration. Yeah. Okay, now this is a different sound. This is supposed to be the Z, as in measure. Now tell me where you're feeling that.
We're not feeling it all.
You should be able to feel it somewhere in between your molars.
I hear it, but I don't feel it anywhere.
Okay, let's take a break from that one. We're going to go ahead and skip over it. We'll come back to it. Okay. Let's try the R sound. So what I have is an O in front of the R. That helps you round your lips as you're making the sound. So something like
This was sound. This was the R.
Like you're saying or, right? And you're holding out that R sound at the end. There you go. Where are you feeling it? Where are you feeling the R sound? Okay, good. Yeah, anytime you round those lips, you're really helping to bring that voice forward. Okay, how about the L sound?
Right about my tongue.
So somewhere in your oral cavity, then that's a check mark. Okay, how about the Z? We've done that one before, now you're just adding more voice to it. Where are you feeling that one?
Right there with my tongue.
Okay, how about the V sound? Maybe against your bottom lip?
Yes.
Okay. Okay, now this one is ing, as in sing. Now that's another nasal sound, so you should be able to feel it in your nose. Okay, but we want to keep it from dropping down into our throat.
Right.
So it starts out strong, but we want to keep it there. We don't want to let it fall back. Still feeling it somewhere in your mouth?
Yeah. Yeah, right in the back of my mouth.
Great, yeah. Well, you know that G sound is gonna sort of force you back into the very tail end of your mouth. That's
Okay.
where we make the G sound,
Okay.
right? It's made with our soft palate, the soft portion of our palate. So you should be able to feel it somewhere in the back as long as it stays here and doesn't drop down here.
Okay.
Okay? All right, so let's go back to the one that gave you a little bit of a challenge. That's the any vibration in your mouth?
It's my tongue, really.
So it's not the Z sound. It's not going to be Z. It's going to be. There you go. Much better. Are you feeling it in your mouth?
Yes.
Okay. So sometimes it takes going through these a number of times and also figuring out what you can do. Sorry about that. Figuring out what you can do to get it to come forward where you actually feel the vibrations in your mouth or on your nose. Okay? So we're going to go ahead and have you do that at home.
Okay.
Okay? We're going to work on isolated sounds.
Right.
And I want you to think about pitch, loudness, and breath support. As you're working through these, think about how you can make adjustments to any of these three to help bring your voice forward.
Right.
Okay, so whether it's adjusting the pitch higher or lower, or maybe keeping somewhere in the mid-range where it's not too high, not too low, adjusting the loudness, maybe you have to come down, maybe you have to be a little softer, or maybe you have to be louder. I want you to play around with that and see what
Okay.
helps you.
See, what I have to do to make these sound as best they can. So maybe I could record them and and describe what I'm doing to make them loudest and
Yes, yeah, you can do that. You can either jot it down somewhere, or you can describe it on an audio recording and have come back so that we can look at the different ways that you
achieve the best
achieve,
sound
and concentrate on what you feel. Okay, so don't only go off of what you're hearing, but rather what you're feeling.
Right.
Okay, that's why I kept asking you, where do you feel it? Because I want you to begin to perceive those differences in the sounds. Okay, again, some sounds are more obvious than others, but because of the placement of these different sounds, you're going to feel it in different places, as long as it's somewhere in the mouth or in the nose. Okay, so that's what I want you to work on now. You have the option of sort of going back and forth between skill 3 of flow phonation and this. Otherwise, if you want to spend most of your time working on this, you can do that.
Don't do these.
Don't do that just yet. That's why I've circled sounds. I want to be able to be here with you as you're adding a little bit more complexity. Okay?
Okay, see, we're ready now. We got organizer.
That's neat. I like that you have that.
Less about that one. We like school supplies.
Yeah, I do too. Now, we didn't have a chance to go over forte, but I would like for you to continue with that at home. Okay? That's why I wrote down here, continue with forte. So this isn't a substitution, it's rather something that we're adding.
Okay.
Okay, and again, to be performed twice a day.
Now, what was the forte again?
The forte is where you are,
Oh, the loud.
Yeah,
Forte,
where
right.
you're holding out for the first exercise,
Right.
and then for the second you're kind of going through the range, and then by the third you're yelling those phrases over the fence
Oh, yeah.
with a high pitch. I think that's the one that you felt more comfortable performing in your car,
Yes,
right?
I did.
Okay. All right, and then for warm up, I'd like for you to continue with the large straw. When you come back to see me next, hopefully we can get you to transition to the smaller straw. Okay?
Okay.
All right.
And the idea of that is to conserve air,
For
the smaller,
which?
the smaller straw.
Well, it's a little bit more of a challenge, but it creates more back pressure than the larger diameter.
Right.
Because we're trying to get you to relax your throat and to keep things, prevent things from sort of tightening up.
Okay.
Okay. All right. So that's going to be your sheet for today. Did you want to sign us off on your video?
We why don't you say a few parting words? Okay. I'm going to practice the resonant voice exercise that we just learned, and going to find out what will it take to make these consonant sounds sound the best and the most effective, and describe what I'm doing to get there.
Yep.
And that will be for next week. So thank you very much for joining us.
Thank you.